Good afternoon, and welcome to this edition of Disability Chats. Each month, HDSA and our resident disability expert, Allison Bartlett, will tackle some of the most challenging issues surrounding disability and Huntington's disease. At the end of each chat, Allison will take questions from the audience. It's easy to ask a question, and all questions will be answered after the presentation. But if you send a question at any time during Allison's presentation, just click on the chat function in the toolbar, type your question, and hit send. Your questions can't be seen by others, only by HDSA. The presentation will be available in about a week on HDSA's YouTube channel or by going to hdsA.org/disabilitychat. Today's chat will focus on starting the disability application process. On March 19th, we'll be discussing debunking disability myths, which will be an in-depth look at some common Social Security disability myths at every stage of the disability process. On May 21, Allison will discuss disability red flags, and on the 16th, we'll chat about completing disability forms. Allison Bartlett is HDSA's Manager of Disability Programs and is a disability attorney who specializes in representing clients with rare chronic conditions like Huntington's disease to navigate them through the complex disability system. Allison holds a JD from the University of Cincinnati College of Law and a BA in International Affairs from James Madison University. She has been admitted to the Virginia Bar. And now I'll turn it over to Allison.
Thank you, Deb. And good afternoon, everyone. So today we are going to be talking about what you need to know, preparing to file a disability application and collecting medical records. So today is going to be an overview of when to start preparing a disability claim, what information to gather, how to collect medical records and other evidence, and completing the application. So I'm going to take you guys step by step through starting the disability process, gathering evidence, collecting medical records, and being ready to file your disability application. So starting the disability process. This is really important, and it's really important to prepare for the disability process because it's like a lot of other things you would do in your life. Would you apply for a job without confirming your qualifications, or go to the job interview without preparing? Would you buy a car without checking out the car or going for a test drive first? Most people would answer no to these questions, and a disability application is no different. Preparation is essential to giving you the best chance to getting a positive outcome and an approval when you submit the application the first time. So preparation can help expedite the case, and this is because it gives, if you give all of the evidence and documentation to Social Security up front, then they will not have to spend as much time, if any, gathering that same evidence. Preparation can also help you get approved because you are making sure Social Security gets all of the information they need to make a decision. It can also help you better understand and describe your symptoms and limitations because it gives you time to take a step back and really think about your day-to-day life. When you're impacted by HD, it can be hard to see the day-to-day changes because you live it. It is like losing 10 pounds. The friend who sees you every day may not notice the weight loss, but the friend that only sees you every 6 months does notice because it is a big change to them. When you live in this situation, it can be really hard to notice those little changes. So starting to think about everything in advance gives you time to figure those things out. And preparing in advance can help you advocate for your case with Social Security because you'll be more confident about what information is in your case and how your condition impacts you. And a really important tip, you should have copies of your medical records and know what is written in them. Because when you submit a disability application, the burden is on you to prove that you are disabled. It's not Social Security's burden to show that you are disabled. The onus is on you to present evidence and show that you are disabled. So there are several misconceptions that prevent people from starting a disability application. First is that you have to stop working to apply for disability. Substantial gainful activity is $1,260 per month in 2020. When you start working under that amount, you can apply for disability. For some individuals, it may mean they have been able to apply for disability for months or even years. So you can backdate the start of the disability if there is supporting medical evidence. And another misconception is you have to wait to apply for disability. As long as you have supporting medical evidence, you can submit a disability application the day after you stop working. Getting sick pay, leftover vacation time, short-term or long-term disability does not count as work for Social Security purposes. I recommend and encourage you to have temporary income sources before applying for disability benefits. None of us are in the position to go 1 or 2 years without income, without financial assistance. And the last misconception is the process will only take a few months. The national average for getting a decision at the initial application level is 6 months, assuming you are approved, which is a long time to go without income, but some families have to wait 3 or more years and go through multiple appeals. Even if you are approved for benefits, it still may take Social Security weeks or months to process the decision. The payment processing centers have 60 days to process your benefit payments once you have been approved. But there are extenuating circumstances depending on the complexity of your situation in your case. I had a client that took 6 months to get her full benefits and back pay because she had a very large amount owed to her and her children. What further complicated the situation was that her children had become adults while her application was pending and had to schedule their own appointments with Social Security, but Social Security failed to tell us that. So when we finally got everything situated, she got her back pay, but I don't want anybody to be in the situation where it takes them months and months and months to get the money that they need. So this is an ideal disability timeline. This timeline is not set in stone and it exists in an ideal world. But the point is to illustrate that the disability application is a much longer process and takes planning. It is not simply answering questions on a piece of paper. It is a journey. And the better prepared you are for the journey, the faster the journey can go. The point of all of this is to help give you the best chance of getting approved in the shortest amount of time. So well before you actually start thinking about submitting a paper application 5+ years, especially if you haven't gotten genetic testing yet, you want to start researching private insurance like disability and long-term care, because a lot of private insurance providers will not give you benefits if you've tested positive for HD, and some may not even give you benefits if you have HD in your family. So it's something you need to start thinking about years in advance just to protect yourself and have that information. Even if you don't ultimately get those benefits, it's at least good to do your research and know what's out there. Let's say you have tested for HD and you are positive. And so it's good to start seeing a neurologist as soon as possible to create a baseline of symptoms and track HD progression. Generally speaking, if you have tested positive but you're not symptomatic, a neurologist at most wants to see you once a year. But it's still good to go because it's good to create that baseline, because once your symptoms become active, it's going to show a change. And having that documented medical evidence, being able to show that change, is going to be really helpful for your disability application. You also want to make sure you are enrolled in employer-provided short-term and long-term disability if they are available. I recommend this to everyone, whether you have HD or not. And the reason you want to make sure you're enrolled in these programs is because a lot of them, even though you have to get them. There's no limitations. Like if these benefits are through the employer, there are no restrictions, like they can't deny you just because you have Huntington's disease. But if you haven't been paying into them long enough, you may not be able to actually receive the benefits. A lot of these employer-provided short-term and long-term disability programs require you to be paying in for at least a year before you can actually take the benefit. Let's say you've tested positive for HD, you've been going to the doctor for a few years, and you've finally started to become symptomatic. It's getting to the point where you're kind of starting to think now, you may need to stop working in your future. So let's say this is about a year out. You want to confirm that you still have short-term and long-term disability benefits with your employer. You want to confirm the process for getting how you activate those benefits and what has to be put in place for you to actually get those benefits. And that's also when you need to start talking to your neurologist that you're thinking about applying for disability. And you want to make sure you tell your neurologist so they can in advance, so they can also help you prepare for the disability application. They can help you prepare by scheduling additional testing that might be necessary or just add evidence to your claim, like a neuropsychological evaluation, a driving evaluation, or even occupational therapy evaluation. Occupational therapy records can be very, very helpful for a disability claim. They can also take updated medical notes. I know there are some neurologists that start changing the way they write notes in your record if they know you're going to apply for disability. They start adding things like as having difficulty working, or now they have issues with memory loss, which is impacting their ability to work. You will likely also need your neurologist to complete disability forms because often for short-term and long-term disability, they require some kind of form from your doctor, and they could also write a letter for your claim. So once you've kind of started thinking about all of this, a few months go by and you've really kind of confirmed that you're going to need to stop working in the next 6 months to a year. So this is really important for you to start gathering evidence in the form of medical records and letters from family, friends, employers, and physicians. So when you are ready to stop working, you already have all of that evidence and you don't have to take more time before you submit the application to do it. So you've gathered your evidence and you're ready to stop working. So about a month out, at least a month out, you want to begin planning your last day of work. You want to start working with your HR department to start the disability paperwork with employers so you can make sure you get your short-term and long-term disability benefits if you are signed up for them. This is really important because if you are fired from your job before you have started the short-term or long-term disability process, most of the time you will lose access to those benefits. In the alternative, you can also begin planning when you're going to cut back at your hours at work and earn less than $1,260 per month. Because as long as you're making less than that amount, you can apply for disability. One caveat with that, I do recommend that you work at the lower amount. You work below substantial gainful activity or $1,260 a month for at least a month before you submit your disability application, just to make sure you are able to work under that amount. You can backdate the start of the application, like the date that your disability started, to the beginning of the month, but you at least want to make sure you can stay under that amount and you have an idea of what that looks like so you don't put your application in jeopardy when you do actually submit the application. In my experience, the biggest warning signs for stopping work and applying for disability are when you start having issues at work. For a lot of people, they struggle to figure out when they need to stop working. So should I keep working? Is it time to apply for disability? How do I know it is the right time? In my experience, the biggest warning signs and triggers that you need to apply for disability are when you start having issues at work, you have trouble holding a job consistently, you have not worked in over 12 months, or you are making less than $5,500 per year. So if you start having issues at work, that includes an inability to perform job tasks, trouble interacting with coworkers and supervisors, and difficulty attending work and concentrating. If you are unable to perform your essential job tasks, you've started making mistakes, you struggle to perform tasks that were not an issue in the past. Behavioral changes could be the reason why you have trouble interacting with coworkers and supervisors now. And if you have trouble concentrating during the day, it means you could be off task, or you need a lot more breaks, or you start being late to work or leave early. Holding a job consistently. So if you're unable to keep a job for more than 3 months at a time or have multiple jobs in a 12-month period, this could be a sign you need to apply for disability. If you have not worked in a year, and chances are not high you're going to return to work. Maybe you have submitted multiple job applications, but no one has hired you, or you don't have the cognitive ability or the energy to submit job applications. You've already waited a year, so at this point, you need to start working on preparing a disability application. Because you can always go back to work in the future. You can even go back to work and still be on disability. So it's just better to start that process and put that work in to make sure you don't lose your benefits. And the biggest warning sign is if you're making less than $5,500 a year, because this means you're not earning all of your 4 quarters of credits. For your work history. So this is the ultimate red flag because it likely means you are on the cusp of losing your work credit eligibility. It is like living paycheck to paycheck, but you are living work credit to work credit. You will likely be able to backdate the start of your disability, but I do not want anyone to be in the position where they could lose their disability benefits because they waited too long to apply. I am pretty sure I have said this in every webinar so far, and I'm going to keep saying it until it becomes common knowledge. So what are the first steps? Before you submit a disability application for Huntington's disease, you need to familiarize yourself with Social Security's rules and regulations because they will help create a guideline for the information you need to include with your application. One of the first things you should look at is Social Security's listings for how they evaluate an HD claim, listing 11.17 for neurodegenerative disorders such as Huntington's disease. That is the official name of the listing. And you want to look at what symptoms and limitations you must show to be found disabled. You should also familiarize yourself with compassionate allowance because you will need to request it in your application. Social Security is supposed to automatically recognize and flag compassionate allowance cases, like adult onset Huntington's disease, but that is not always the case. It is better to be safe and proactive than take the risk that Social Security may make a mistake. The compassionate allowance information also provides a nice overview of what kind of medical evidence Social Security is looking for in an HD application. You also want to understand the application process. So how you submit an application, where you need to go, and what the evolution of the process looks like. I have included direct links to the listing information and compassionate allowance along with the disability booklet that I've created. So once this video and PowerPoint have been posted, you'll be able to access the resources. You can also find helpful resources on HDSA's website under Applying for Disability Resource Guides. It is also very important that you and your family understand your symptoms and limitations so you can accurately describe them in the application. You have to remember that Social Security is going to judge you based on your paper application and your medical records. You need to be as detailed as possible. You have to remember that Social Security is going to judge you based on your paper application and your paper medical records. You need to be as detailed as possible, and you can only do that if you understand your symptoms and limitations. Once you understand what Social Security is looking for in an HD disability application and you understand your own symptoms and limitations, you need to start gathering evidence. What kind of evidence do you need to gather? You need to gather medical evidence, evidence of your activities of daily living, employment records, and education records. So where do you get this evidence from? You get it from doctors, therapists, employers, and your friends and family. How do you gather evidence? You gather it through medical records, medical letters, letters from friends and families and employers, and your own personal experience. Medical evidence is the most important evidence you need to submit with your claim. It is Social Security's #1 factor in determining if someone is disabled. If you do not have medical evidence, Social Security cannot and will not find you disabled. There are no exceptions. As I discussed in previous webinars, you must have a medically determinable impairment to be found disabled under Social Security's rules. In order to show you have a medically determinable impairment, you must have medical records documenting your Huntington's disease diagnosis and the existence of your Huntington's disease. While medical evidence is the most important type of evidence, I'm going to discuss it last today because it can be the most difficult type of evidence to obtain, and it comes with its own set of rules. Of the 4 types of evidence, medical records, activities of daily living, employment records, and education records, the biggest responsibility for individuals and families is activities of daily living, because the only people who know the full extent of the symptoms and limitations you experience every day are yourself, and most often, your family. Social Security is not going to be able to describe your activities of daily living for you, and your physician may not know the full extent of your day-to-day limitations because they do not see you every day. So activities of daily living are the routine activities people do every day without assistance. So they're the bare minimum to care for yourself. And they include eating, bathing, getting dressed, toileting, continence, and transferring position. Eating is not just feeding yourself, but are you able to make sure you eat and get enough food during the day? Do you eat when you're hungry? Bathing. Are you able to physically bathe yourself? Do you need a shower bar? Is it safer to take baths? This also includes personal hygiene in general. Are you bathing enough? Are you able to shave? Do you brush your teeth? Getting dressed. Do you get dressed? Do you put on clean clothes? Do you change your clothes every day? Do you need help getting dressed? Do you have to sit down to get dressed? Toileting. Do you have trouble sitting down on the toilet or getting up? Continence. Are you able to make it to the bathroom when you go to the bathroom? And transferring position, getting on and off the bed, standing from a seating position, walking. Social Security is also looking at the instrumental activities of daily living, or a person's ability to live independently and thrive. This is the minimum capacity you have to be able to live on your own without assistance. Companionship and mental support. Are you isolated? Do you see friends and family regularly? Transportation and shopping. Are you able to drive? Are you able to take public transportation? Can you go shopping for yourself and get things you need? Can you go to the grocery store without assistance? Planning and preparing meals. Are you able to cook meals from scratch? Do you reheat meals? Do you use the oven or stove? Does someone else do most of the cooking for you now? Managing the household. Are you able to complete chores? Are you able to complete chores in a timely fashion? Managing medications. Do you remember to take your medications? Communicating with others. Are you able to have conversations with others? Have you become irritable? And managing finances. Are you able to manage your bank account? Do you pay bills on time? Are you able to keep track of cash or pay for items with cash? Social Security looks at all of these factors because an inability to care for yourself also indicates an inability to work. So how do you gather evidence about your activities of daily living? First, I highly recommend keeping a journal. It is not something you have to write in every day, but it is good to write down your symptoms and what you experience when you have a bad day. Being able to accurately describe a bad day is very important because you want to complete your disability application from the perspective of a bad day. The disability application is about what you cannot do. This means you also need to be able to talk about the changes you have made to your daily life and what accommodations you have put in place to help you perform daily tasks. Accommodations include big things like needing a shower bar or using a walker, but it also includes little things like having to take a nap now during the day, having to take a break when washing dishes, only using the microwave to reheat meals when you used to cook from scratch, or even changing the kind of clothes you wear because you can no longer use buttons or zippers. The benefit of keeping a journal is once you start working on the application, you'll be able to look through the journal to provide examples. Keeping a journal will also help you talk to your doctors about the symptoms and changes that you've noticed. You can also write a letter to Social Security. Be sure to include what you want Social Security to know about your HD and how it has impacted your life. Writing a letter in advance will give you time to think about what you want to share with Social Security and what you want to put in your application, which lowers the chance that you will forget important information. You also want to get letters from friends and family because they are often better able to see and describe how HD has impacted your life. Letters should come from people who know you best and who have seen how HD impacts you. Letters from friends and family should create a timeline of events and provide specific examples about symptoms and limitations. In cases where medical records are limited, letters from friends and family can really help a disability claim because the letters can fill in the gaps. I have had several clients whose cases, in my opinion, were positively impacted by letters from friends and family. And another benefit of you writing your own letter to Social Security to submit with your disability claim, it means you know what you want to talk about in advance and you can make sure you include all of that information. This is not something you should do off the cuff the day of. You will definitely leave important information out and you'll miss something that could potentially risk getting a positive decision in your application. So the next type of evidence is work history and employment records. The Social Security disability application is going to ask you multiple questions about your work history. You need to be prepared to answer questions about your past work. The application asks for all of the jobs that you have had in the last 15 years before you stopped working, along with the month and year that you started and ended the job. If you cannot remember the exact dates you work, that is okay. Just provide your best guess. It is better to provide an estimate than to leave the dates blank. You will also need to provide your job titles, job descriptions, and you will need the addresses and phone numbers for your most recent jobs. If you have a resume, I recommend submitting it with your application because it includes your job titles, dates worked, and job descriptions. You need to accurately describe your past work and the job tasks you were expected to perform so Social Security understands why you are not able to work anymore. And you can also submit this information through your employment record. So including your employment record. If you started to struggle at your job before you stopped working, then it could be good to submit performance reviews or disciplinary actions as evidence that you had trouble performing your job because of your HD symptoms. If your performance reviews do not indicate that you struggled with your job, then do not submit them. This is not evidence that is required by Social Security, so you can decide if you want to submit it or not. Submit it if it will be helpful, if it will provide good evidence, but if you never disclosed to your employer that you had HD or they didn't know why you were struggling, it may not be worthwhile to submit it because it may paint you in an unfavorable light that's not accurate. but it's still good to look through that information and decide if you want to submit it or not. And not everyone has this evidence in their employment record, and that is okay. If you worked for a very understanding and accommodating boss, then it might be better to ask for a letter from your former employer, especially if you've been able to keep your same job with the understanding that you could not perform it at the same level of your coworkers. In my experience, the work history section is often the most difficult section of the application for families because it can be very hard to remember where someone worked for 15 years or where they worked 15 years ago or the specifics of the job tasks. Gathering your work history in advance will save you a lot of time once you start completing the application. Also, it is okay if you cannot remember all of the details of your past work and you have to make your best guess, as long as you let Social Security know that you have provided the information to the best of your ability. And if you do decide to get letters from coworkers or supervisors, it's important that they include a timeline of event and they list changes in your ability to work and any job accommodations that you have been given. Social Security takes job accommodations very seriously because if someone gave you so much of a job accommodation that they would never have hired someone else to do the job that you do it, then it also means that you couldn't work and you just had a very wonderful employer, because Social Security does look at those things. But education records. Education records are only relevant for younger individuals under 25 and individuals that have recently attended school. It will be important to collect records if you are filing for adult child disability benefits and are trying to show that you became disabled before age 22. If you are going to collect education records, it is important to note that you will need to collect different kinds of records depending on when you attended school most recently. If you are 23, did not attend college, and are trying to show that you have been impacted by HD since you were 17, then you want to include your high school education records. If you are 23, attended college, and started to experience symptoms at 21, then your college records would be enough. If you're going to include high school records, you want to include things like your individualized education program, or your IEP, proof of special education classes, any accommodations provided by the school, like being given more time to take tests, taking tests in a quiet room, and having more time to complete assignments, and state test scores, especially if the state mandates testing to graduate high school, for example, states like Ohio. And it's still good to submit the test scores as evidence, even if you did well in high school, because those can also show a change. So let's say your symptoms didn't really start impacting you until college, but showing the test scores from high school could create that like baseline to show how things have gotten worse. So if you have your test scores from high school and then you submit how you did in college, it can show that decline, which can also be really helpful for Social Security. Social Security loves to see documented decline. It makes it easier for them to find someone disabled and for them to do their jobs. If you're going to include college or trade school records, you want to include things like accommodations provided by the school. Again, things like being given more time to test, taking tests in a quiet room, and having more time to complete assignments. You should also include your grades, attendance record, class schedule, and you want to be clear whether you are a full-time or part-time student. If you only went to school part-time because it was overwhelming and you could not handle the burden of a heavier class schedule, and you had trouble keeping up with work even being part-time student, then you want to include that information. The more information you can provide about your symptoms and limitations, the better. So now on to medical evidence. Medical evidence includes medical records and medical letters. Medical records can come from a number of places. Most, if not all, of your medical records should come from doctors and hospitals, but they can also come from prisons and correctional facilities, welfare agencies, and insurance companies who have paid disability benefits. I do not have personal experience getting records from insurance companies, but it could be a good place to start because most insurance companies collect medical records before paying out a disability claim. Your long-term disability provider could have all of your medical records, and it is in their best interest to help you get Social Security disability. Most, if not all, private long-term disability providers require you to apply for Social Security disability. So if your insurance company already had to get records to find you disabled for their policies, they might be willing to give you all of those records so you can submit them to Social Security. Medical records are also very helpful, especially if they are thorough. Medical letters are also very helpful, especially if they are thorough, detailed, and well written. A neurologist will have the best insight into your condition, so the letter should come from your treating neurologist. They will also know the most about your HD. A treating psychiatrist can also be helpful in these circumstances, especially if you have a lot of psychiatric symptoms, if you have really bad anxiety or depression or things like that. It is imperative that the letter is detailed and supported by medical evidence. Otherwise, Social Security will ignore the letter and might even put less weight into the records from your treating neurologist. You are required to submit all medical records from your doctors, but you are not required to submit the medical letter if it is not very detailed or supported. The letter needs to specify your symptoms and limitations and how they prevent you from working. Your doctor stating that you are disabled without proof is not enough, and Social Security does not like it. I recently had a client that was denied, and the entire decision was the judge saying really mean and unhelpful comments about the treating neurologist because they didn't think there was enough evidence in the case. You do not want to be put in that position. And so it's really good to be open and honest and have this conversation with your doctor, because the way your doctor takes notes and what Social Security is looking for are two different things. And you don't want to get in the middle of Social Security's fights with how doctors take medical record notes. But you want to be open and honest and tell your doctors what you need and work with them to make sure you're benefited. So collecting medical records is an important part of the disability process because medical records are essential for your claim. You cannot be found disabled without medical records because you must show that you have a medically determinable impairment. Collecting medical records can be a complicated and time-consuming process, and this is true for Social Security too. Medical record departments get backlogged, are understaffed, and misplace medical record requests. I have experienced all of this firsthand. It is better for you to get your records so you can ensure Social Security gets them too. Knowing what is in your medical records can also help you write about your HD symptoms and limitations in your application. You do not want to rely on Social Security to collect medical records for your claim because they may not get all of your records, which could lead to a denial. I have had many families tell me that Social Security did not get records from their HD clinic or other important doctors. This does not mean that Social Security did not try. It means that Social Security was not able to obtain the records, and this happens. Social Security is only allowed to follow up on medical records a limited number of times, and if they do not get the important records for your case, they will have to make a decision about your disability without them. You do not want to take that risk. I have also encountered some HD clinics that are difficult for Social Security to request records from because they do not actually know where to send the request, or they get returned requests stating no patient exists, which is not true. Two clinics that I've seen this happen to is the HDSA Center of Excellence at Columbia University / NYS Psychiatric Institute, because they're connected to both facilities. So Social Security will send a request to the NYS Psychiatric Institute, but they won't have record of the patient. I've also seen this happen with the Samuel L. Bailey Huntington's Disease Family Service Center at Rutgers. So if you go to one of these clinics, I always just put in the social worker's contact information. So then Social Security can send the request directly to the social worker, who can make sure that gets to the right person and the records are received. And that just happens sometimes. Sometimes it's kind of complicated the way things fall. It doesn't always make sense, but it's always good to have a social worker involved, and I always say it's really good to include the social worker's contact information in the application so it gets to the right person. Because people who work in the medical record departments likely have no idea who you are, and they don't know why they're being sent to request, but your social worker will. So how do you obtain medical records? There are 3 ways to collect medical records: through your patient portal, your doctors, and a formal request sent to the medical record department. The patient portal is the easiest way to collect your records because you just log in and you can download your records. My chart is an example of a patient portal. Not all patient portals are created the same because every hospital / patient portal provider has different access rules. If you are treated at Duke, you can download your full appointment records and clinic notes, including your HD Clinic neurology appointments, through their portal. The only exception is psychiatric records, but this is true of a lot of facilities. If you are treated at Northwestern Medicine, you can download records, but they only include your medications and list of diagnoses, not the full clinic records that Social Security needs to see, which means you need to send a request to the medical record department. I always recommend talking to your doctors and social workers directly about collecting medical records because they may be, they may be able to print and give them to you without having to go through the medical record department. A lot of laws have gotten stricter about medical records in the last few years, so this option is less likely, but it is always worth asking. The best way to collect your entire medical record file is to request them directly from the medical record department, which you can do in person or online and by fax or email, depending on the facility. So how do you submit a request? The easiest way to submit a medical record request is through your online patient portal, and I highly recommend trying this option first. I forgot to mention, if you have access to your patient portal and you have access to your full clinic notes and records, download them because that's free. I will talk about this in a few slides, but medical records can be very expensive. If you can get your medical records for free through a patient portal, sign up for the patient portal, download the records, and get your records for free. If you can't get your records through your patient portal, then you're going to have to request them. An easy way to request them is a lot of my charts do have the option to request records through your patient portal. The other way to submit a medical record request is to complete a release of medical information from your treating facility. So Duke, Columbia, Ohio State, University of Washington, UCLA, etc. Every facility has their own release, and sending it so once you've completed the release, you need to send it to the medical record department at that facility. Completing a medical release can be a little daunting because there is a lot of information on the form. You want to make sure you include the correct address for where the record should be sent, yours, a family member, or your attorney, whoever. You also want to include dates of service. I tell everyone to overestimate because people often forget the exact date they started seeing their doctor, and it is always better to go farther back than miss an important appointment. It is also important you check all of the facilities where you were treated, and if you cannot remember, check the facilities anyway. You will not be charged for records that do not exist, and you do not want to have to submit additional requests because you checked the wrong facility. When checking what medical information you need, always include consultations and evaluations, outpatient records, progress notes, and diagnostic imaging reports. Once you have completed the release, submit it to the medical record department in person via fax or email. I have included a few samples of what these medical record requests and releases look like. This is a medical record request through my chart. It tells you how far back you can request records from certain hospitals in that hospital system. And then you just include your approximate service, date, ranges, your phone number, and the information you're requesting. This is an example of a medical record release from Northwestern Medicine. As you can see, it includes all of the different hospitals in the Northwestern Medicine system. It also includes requested medical information. And it has a place for you to, whether you want to include certain information or not. And this is a release from UCLA. As you can see, they look very similar, but every hospital system has their own release, and the fastest and easiest way to make sure you are going to get your medical records is to use your hospital system's medical releases. So once you've submitted a medical record request, it is very important to follow up on the medical record request to make sure the requests are received and processed. It is easy to follow up on requests. Every medical record department has a phone number that can be found on their medical release. Call the number and follow the prompts. If you are not able to speak with someone, leave a detailed message with your name, date of birth, the date you submitted the request, and your phone number. I cannot stress this enough. The medical record department cannot and will not call you back if you do not leave this information. When you call, make sure to have the date of birth of the persons whose records you requested, especially if they are not your own, and the date you submitted the request. I recommend taking notes during the phone call, get the name of the person you speak with, and what action has been taken on the request in case something gets messed up or backed up and you have to call back. As a general rule, follow up once per week until the records are received. If your request is received and processing takes up to 18 or 30 days, it is okay if you do not call every week. Calling every other week should be okay. The important thing is that the request is received and it's moved to processing. So I mentioned this earlier, but medical record costs. Medical records can be very expensive, which puts a burden on families and can act as a barrier between you and your records. The good news is that in a number of states, a patient is entitled to a free copy of their medical records if the records are for disability or another public benefit program. Two examples are California and New York. There are additional states, but these are two of the biggest examples. Each state has different laws regarding medical record costs. I have included a link that outlines the specific state-by-state medical record costs so you can find out more information about your state. On average, fees range from 25 cents per page to $2 per page. And most states allow for a search fee that ranges from $15 to $30 in addition to the per page fee. When requesting records, it might be beneficial to include a copy of the state law with the request if the record should be free. Don't assume the medical record processing facilities know the law, and be prepared to work with the medical record facility to lower the cost of records if necessary. The number of times I've had to resubmit a medical record request to the state of New York because I had to argue with the medical record department to get free records is pretty high. So just be prepared to advocate for yourself because it's written in New York state law. And so it's okay if you get your records back with a bill. Just be prepared to submit the state law. And for California and New York, I have included the state codes, so you can go to them and print that information out. And a way to reduce costs is by only requesting what you need. Only get clinic notes or hospital admission and discharge notes. Do not request blood work or lab reports. These can take up hundreds of unnecessary pages and do not help with an HD claim. There are other conditions where blood work is important. HD is not one of them, especially because it's not something Social Security is going to look at based on their listing. And you really only want to request records once, especially if they're going to be expensive. Generally speaking, the first time around is the most expensive because that's when you're giving the biggest portion of records. If you continue to get records, it might only be one set of records at a time, so it's not going to be as much money. But you really only want to do this, so you have to do it once. So now that we've talked about gathering all of this evidence, when should you be ready to file your disability application? You want to wait to file until you have gathered as much evidence as possible, but at a minimum, only file after you have obtained your HD medical records because these are essential to your claim. Again, also make sure you have stopped working or you are making less than $1,260 per month gross. You want to keep all of the evidence in one place so it is easy to find information once you start the application. I recommend keeping everything in a folder or binder by information type. All of your medical information should be together, all of your work information should be together, and all of your information about your activities of daily living should be together because the application is broken down into similar sections. Do not rush through the application. This is a marathon, not a sprint. I would say this is actually a triathlon because there are multiple stages to this race. A triathlon has 3 components: swimming, biking, and running, and the disability application has 3 components: gathering evidence, completing the application, and communicating and working with Social Security while your application is pending. So how do you file an application? There are 3 ways you can file an application. You can go in person, which means you go to Social Security and complete the application with a representative in one sitting. This takes a few hours. This is best for people who have gathered lots of evidence and want to confirm it is submitted with the claim because you physically hand all the evidence to the representative that you sit with. You can also file online. You can complete an online application on your own. You can re-enter the application and take up to 3 months to complete it. So it does not have to all be done in one sitting. This is best for people who live far away from a Social Security field office and those helping someone complete an application. And the last way is by phone. You can complete the application over the phone with a Social Security representative. This takes a few hours. This is similar to what you would do in person, but it does give you the least amount of control over what is submitted in the application, and it also doesn't allow you to submit the evidence with your application then and there. So what should you include in the application? First and foremost, the application should be written from the perspective of a bad day. I cannot stress this enough. You have to make sure you include adult onset Huntington's disease per listing 11.17, and I recommend using adult onset Huntington's disease. You want to show the symptoms you experience and the limitations caused by those symptoms. You also want to indicate compassionate allowance in your application, and you should include Social Security's rule for compassionate allowance. For Huntington's disease, that's DI 23022.923. I would put in that exact code in the application to make sure Social Security flags your claim for compassionate allowance. You're going to need information about your marriage, prior marriage, and children. You're also going to need information about your spouse, their name, date of birth, and Social Security number. Also, the date and location of marriage and the date and location of divorce if you are divorced. You're going to need your past 15 years of work history, including your employer name and address, dates of employment, job details, including your rate of pay, days and hours per week that you worked, and physical job tasks. You're going to need your total earnings for the past 2 years. You're also going to need to include all physical and mental conditions. And when I say all, I mean all. Adult onset Huntington's disease, if you have anxiety, if you have depression, high blood pressure, obstructive sleep apnea, chronic back pain, all of those things should be included. What should not be included are things like memory loss, because that's a symptom of the Huntington's disease. But if you're not sure, list it anyway. And then you need to include all of your doctor's information, and not just the name. You need their contact information, their phone, their address, and their fax number. You're going to need the first appointment that you saw them, your last appointment, and any upcoming appointments. You also need to include your medical tests and the medications that you have been prescribed. So once you've completed the application, what should you submit with the application? You should submit all of the personal records that you have collected. So all the medical evidence, medical records, medical letters, all of your employment records, including a resume, your education records, and your activities of daily living in the form of letters. Your activities of daily living will also be included in the body of the application and the way you answer questions. Most of that will be submitted in the remarks section if you do it online. So the remarks section gives you 2 large empty boxes where you can put in whatever information you want. You should fill those boxes and use every single character that you are allowed to stress to Social Security, your symptoms and limitations, and why you can't work. And you're going to want to submit your earnings and pay stubs if you are still working to show that you meet the substantial gainful activity criteria. For Social Security forms, depending on your circumstance, you may want to submit an appointment of representative form. This can be really helpful if you are helping a family member submit an application. So you can submit an appointment of representative form even if you're just a friend or family member. It's not just for attorneys. And I highly recommend this if you're helping a family member who's not going to be able to answer Social Security's phone calls or return forms in a timely manner. You want to do this so Social Security is able and has to contact you too. Another potential form is something called a work activity report, and those are for individuals who are still working. So how do you submit evidence? So you can submit evidence in person at the Social Security field office. So you do this when you're completing the application with a Social Security representative, or if you've completed the application online or over the phone, drop off after you complete the application and make sure to get a date-stamped copy of your evidence as confirmation. If you drop off the evidence in person, you cannot simply hand your evidence to a random employee and leave. You must get a number, wait to be called, speak to a representative, and get a date and time stamped confirmation. If you do not do this, your evidence will get lost. This has happened to a number of my former clients because they just gave their evidence to an employee in the office and it was not attached to their claim. I don't want this to happen to anyone else. You have been warned. You can also mail in the evidence. If you submit an application online, you will have the option to print a cover sheet in order to submit your evidence to Social Security. Print the cover sheet and mail the evidence to your local field office. It is important to send the evidence to the correct field office. Only one Social Security field office in the entire country is responsible for your disability claim, so you have to send the evidence to the right office or it could get lost. You can also fax the evidence. You can do this by contacting your local it's a lot of words. You can do this by contacting your local Social Security field office and ask for the fax number to submit records via fax. You also want to include the cover sheet if you have it. Faxing the evidence can be the best because Social Security is going to create an electronic version of your claim. So faxing everything can help it get put into the system faster. So what are best practices when you actually submit the application? Do not undermine your symptoms and limitations. Do not make it seem that you are better than you are. That is only going to hurt your chances of getting disability. If you don't have a lot of awareness into your symptoms and limitations, then you need to get help from someone else. And it's really important to ask for help if you need help. This is not something that should be completed alone. Ask questions if you have questions. This is not an easy process. This is why I have my job, and this is why I'm here. Work with your doctors and social workers throughout this process. You want to keep them informed because they're some of your biggest advocates, and they're the people who play a very important role in helping you get approved. You want to track all of your doctor's appointments and contact information in a journal or a spreadsheet because you want to make sure that Social Security has the information to get the records from the right place. You also want to keep an up-to-date list of your medications and why you take them because Social Security is going to request it. And you want to follow up with Social Security regularly once you have submitted your application. You need to confirm that your application is received. You need to confirm when the application is sent from the field office to Disability Determination Services, and you need to confirm Social Security gets your medical records, especially the HD medical records. And while your claim is pending, Social Security is going to send you additional forms to complete. If you have questions about the forms, it's okay to call Social Security and ask about them. It's also good to follow up with Social Security to make sure the forms are received once you have completed them. Are there any questions?
Okay, so yes, we actually do have a couple of questions. You mentioned that SSA will only follow up on medical record requests a certain amount of times. How often should I follow up on my requests?
You should follow up on your requests with your doctor's office at least once a week, maybe every 2 weeks if they have actually received the request and it's in process. If you should also follow up with Social Security. I recommend following up with Social Security at least once a month. If you have called them and they have said they don't have your records, then follow up at least every 1 to 2 weeks with Social Security and ask if there's any way you can assist them in obtaining their records. If you have records, you can ask Social Security, hey, I have them, how do I get them to you? And they'll usually give you information on how to submit them to Social Security again.
Okay. A second question is, how much time should I allow myself to complete an application online? Do I have to do it all at one time, or if I need to, can I come back to it?
You can allow yourself as much time as you need really to complete an online application. So the online application will be open for about 6 months. Social Security might start harassing you to complete the application before that. So I recommend not taking any more than 3 months to complete it, but you will get a reentry number. And that reentry number will allow you to go in and out of your application as necessary. So let's say you get hung up on a work question, you're not sure exactly what the address was for your employer, it's okay to exit out of that application, get that information, and then go back into the application when you're ready.
Okay, so you say that we should contact Social Security. What's the best way to do that? Is it by phone, by email, send them something in writing? What's the best way to follow up with them?
So the best way to follow up with Social Security is to call your direct local field office. So you see a lot of places tell you to call the national number. Only call the national number if you don't have the number to your field office. And I say this because the national number cannot give you answers about your case. So you have to call your field office, you call the local number. You say, I've submitted a disability application, I submitted it on this date. I'm calling to make sure my evidence has been received, and where are you in the process? Like, is my case still at the field office, or has it gone on to disability determination services? In my experience, the more specific a question you have, the more likely Social Security will be to help you and give you a good answer. And
So does it matter if you have the name of the person that you spoke with the last time, or does every field office have the information and are able to answer your question?
That's a good question. So if you submitted the application in person in the field office and were assigned a representative, contact that representative because they're solely responsible for your case. If you submitted the application online and called in previously and spoke to one person, then it won't matter as much who you speak to next time, because that's not the exact same person assigned to your case. Everyone does get a representative assigned to your case, so if you can find out that representative's contact information, they should be your main point of contact throughout this process.
Okay. I think that concludes our questions.
Well, thank you so much, everyone, and thank you for tuning in today.
Thank you, and we'd like to remind you to join us again on March 19th, when we'll be discussing debunking disability myths, and we'll be taking an in-depth look at some common Social Security disability myths at every stage in the disability process. Thank you so much again for joining us today.